about how we can live healthier to improve our liver health. So there we go. All right, so these are my pertinent disclosures. So just as an overview, in this webinar, we're going to talk a little bit about the role of alcohol in liver health. We'll then describe the effects of obesity and the Western diet on health outcomes. We'll define some healthy eating guidelines, and then we'll provide a couple of tips for weight loss and exercise success. So no discussion about liver health would be complete without a mention of alcohol and its effects on the liver. But the question always comes up, how much alcohol is too much? And when we look at studies as far as alcohol levels and how much actually causes significant damage of the liver, which can then of course lead to cirrhosis, we use the guideline that men should have no more than 2 drinks a day, or about 14 drinks per week, and that women should have no more than 1 drink a day, or 7 drinks a week. Now, when we're talking about drinks, remember that 1 beer is not the same as having a full 12-ounce glass of wine, that the concentration of alcohol in various beverages means that less and less amounts equals 1 beverage. So, for example, a 12-ounce of regular beer is the same as only 5 fluid ounces of wine, which of course is equal to just 1.5 ounces of hard liquor like vodka or brandy. Now, I do want to have the caveat here that I'll sometimes get patients who say, well, I don't drink every day, I just drink on the weekends. And I want to emphasize that you can't store up your 14 drinks a week and drink them in one sitting on Saturday evening when you're out with your friends. It's actually been shown that binge drinking, which is defined as greater than 5 drinks in one sitting, is actually just as harmful, if not more harmful, than daily drinking. I also want to make the caveat that unfortunately, if you have diagnosed chronic liver disease, there is absolutely no safe amount of alcohol that we can recommend, and most hepatologists will advise you to completely abstain from alcohol. So the next point we want to just mention is about obesity and its effect on your liver. Many of you might be aware that obesity is actually the leading cause of chronic liver disease in the United States, and it's an entity known as non-alcoholic fatty liver disease, or NAFLD or NASH. Obesity also increases your risk of developing liver cancer, and it decreases effectiveness of treatments for things like hepatitis C. And if your liver disease were to progress and you were to need a liver transplantation, being overweight or obese will increase your complication rates after surgery. So how did we get this way in our country? How did so many of us become overweight or obese? Well, a lot of it is attributable to what we know as the Western diet. And I think most of us are familiar with what's sort of typical in the American diet. We have a high intake of a lot of fried and sweet foods. We eat a lot of processed food and red meats, a lot of refined grains, and a lot of high-fat dairy products. And if we remember the food pyramid that I think most of us learned when we were growing up, our Western diet, we were taught that you really should base your diet on carbohydrates, eating at least 6 to 11 servings of bread, rice, and pasta. And that's reflected in this diagram of sort of the typical breakdown of a Western diet, where 47% of the typical American's diet has carbohydrates as the base, which means that we only get about 15% of our nutrient source from proteins, and that we also get a significant source of our food energy from fats. And it's really this milieu of dietary breakdown that directly leads to problems with obesity and disease. And there's been a lot of evidence lately showing that the Western diet actually shortens your lifespan. So when Western diet followers are compared to those who don't follow Western diets, we show that you have a 35% increased risk of diabetes, a 30% increased risk of heart disease. You're 50% less likely to have what we call ideal aging, meaning that as you get older, you have an absence of chronic medical conditions and that you're still able to participate in activities of daily living like going to the store and driving a car. And I don't know about you, but I would love to live until I'm 90, but I only want to live till 90 if I can still participate in the I participate in. And it's also been shown that 40 to 50% of Western diet followers, if they're diagnosed with cancer, have a decreased survival, and that they have a 30 to 40% increased odds of disease recurrence if they're diagnosed with colon, breast, or prostate cancer. So obesity really is more than just having increased weight and the physical effects of that, but also the fact that it leads to increased morbidity and increased disease. So what is it about the Western diet in particular that's thought to lead to these poor health outcomes? And a lot of research over the last decade has really focused on sugar. And sugar, in fact, is a pretty dangerous drug, and it has a lot of poor effects on the body. The first is that it promotes cortisol or adrenaline release, which, if you remember, is part of your fight or flight response, and it really revs you up. Sugar also impairs the immune system, and bacteria in your gut actually live off of the metabolism of sugar. And so you know when you eat too much sugar, you get kind of gassy and bloated. The other thing is that it inhibits leptin, which is a hormone that controls appetite. So counterintuitively, is if you end up eating sugar to fuel your system in the afternoon when you get a slump, it'll actually increase your hunger and make you eat more calories. It also promotes oxidative stress, and so that can lead to premature aging and increased cancer risk, as I discussed in the prior slide. And of course, if you're diagnosed with cancer, it actually fuels cancer cells. They've actually done studies in mice where they show mice who've been affected with cancer, and they feed one a high sugar diet and one a low sugar diet, and the cancer grows faster in the mouse who has a high sugar diet. It also promotes fat storage and weight gain, and in particular belly fat or abdominal fat, so that's sort of that apple-shaped fat distribution that we so commonly see in our country. It disrupts amino acid intake into muscle. So not only are you building fat in the wrong places, but you actually end up losing muscle because your muscles can't be built without these important amino acids. We know that it promotes insulin resistance and can directly lead to the development of diabetes. And it can also directly damage your heart muscle and lead to heart failure. And as we mentioned before, sugar can be as toxic to the liver as alcohol in an entity known as non-alcoholic fatty liver disease. And then finally, it ages brain cells and has been linked to an increased risk of dementia and Alzheimer's disease, as well as early cognitive dysfunction. And it causes dopamine release in the brain, which is the neurotransmitter that actually is responsible for addictive behavior. And so sugar is a drug, and it's highly addictive. So if we're not supposed to follow the Western diet, then what diet is recommended to improve our health? Well, if you do a Google search of diets, this is just a sampling of what you'll find. And I know that when patients come and talk to me about healthy eating, that the messaging out there can be very confusing. I think most of us has probably tried one of these diets over the years, and if you look on Amazon.com for diet books, you'll end up with over 50,000 hits. So it can be really confusing to wade through all this. The thing I want to emphasize today, and there's no way that we can discuss all of these and the science behind some of them, is that the reality of healthy living is it's not a diet, it's a lifestyle. If you go on one of these diets, you're going to fail, because healthy living is about lifestyle change and small changes, not about radical overhauls. So I want to provide you with two really great resources for healthy eating guidelines, and the websites are at the top here. The first is from the American Heart Association, which can be found at www.heart.org, and the second is from the Centers for Disease Control at www.cdc.gov. And both of these organizations have extensive resources on healthy eating, portion control, calorie counting, exercise guidelines, which I cannot possibly of all, healthy eating really should be a heart-healthy diet for all Americans because of our risk of cardiovascular disease and diabetes and fatty liver disease. And a heart-healthy diet includes vegetables and fruits that don't have high-calorie sauces or added salt, and of course that evil drug sugar, fiber-rich whole grains, poultry and fish without skin that are prepared in healthy ways, lean cuts of meat. You want to try to incorporate fish at least twice a week, and especially fish that contains omega-3 fatty acids, so things like salmon and trout and herring. You want to try to stick to fat-free or skim or low-fat 1% dairy products in order to try to decrease that percentage of your calories that are coming from fat. And you want to try to avoid foods that have partially hydrogenated vegetable oils to reduce the amounts of trans fat in your diet, which have been linked with worsening risk for heart disease and diabetes. With that, you want to limit the saturated and trans fats by replacing them with healthier fats, which are the monounsaturated and polyunsaturated. So examples of those are olive oils or sesame oil or things like coconut oil. Have a healthier percentage of these monounsaturated and polyunsaturated fats as compared to eating things like margarine or vegetable oil. You want to cut back on beverages and foods with added sugars. So if you're going to do fruit, I'd rather you eat your fruit than drink your fruit. And of course, minimize things like Coca-Cola and sodas that have a lot of added sugar. And then you want to choose foods with low sodium and prepare foods with little or no salt, since we know that that affects blood pressure. So are there liver-specific recommendations as far as healthy eating? Well, there's really not a specific liver diet, but if you have diagnosed liver disease, we do recommend that you don't eat uncooked shellfish such as oysters and clams because of a certain bacteria called Vibrio that can be transmitted through these types of shellfish and are not well handled in people who have chronic liver disease, and they can make you very sick. Again, we do specifically recommend that you limit eating a lot of foods that have sugar or salt. One, because it can increase the risk of fat deposition in the liver, and the other is if you have problems with fluid in your legs or you've had fluid in your belly in the form of ascites, eating salt will make this really, really bad. And then again, we want to limit how much fatty food that you're eating because of the effects of fat intake on the liver. Some liver diseases may have additional specific recommendations, and so it is important to talk to your physician if you have any of the following conditions: hemochromatosis, Wilson's disease, bile duct diseases like primary sclerosing cholangitis or primary biliary cirrhosis, if you have diagnosed cirrhosis as well. And I do just want to put a quick comment in here that among the Google searches for liver diets, there'll be a lot of hits for these liver cleanses or juicing regimens. None of these have been studied whatsoever in liver disease, and there's no evidence that these work, and these would not be recommended for long-term lifestyle change. So when we're talking about weight and weight maintenance, it's important that we define what a healthy weight is. And the way in the medical world that we define healthy weight is using something known as the body mass index, or BMI. And this is a numerical value of your weight in relation to your height. And if you look at the various cut points, a normal BMI is defined as a BMI that's between 18.5 to 25 kilograms per meter squared. Abnormal are the following. If you're less than 18.5, you're actually considered to be underweight. If you're between 25 and 29.9, then you're overweight. If you're greater than 30, you're considered to be medically obese. And if your BMI is greater than 40, it's considered to be extreme obesity. Now here's the formula if you want to calculate your own BMI. I've also included a link to the American Heart Association where you can type in your numbers for your height and your weight, and it'll calculate it for you. And there's a lot of course, online apps and things through your smartphones that you can download calculators for. I do want to note that if you're under 20 years old, or if you're highly trained or athletic, running marathons, if you're pregnant or breastfeeding, BMI may not be the best method of assessing your risk of being overweight or obese, and so it is important to talk to your physician if you get a number that's outside of this range. So maintaining a healthy weight really has benefits that extend far beyond just liver health. By maintaining a healthy weight, you will enjoy a lot of these quality of life factors. You'll have fewer joint and muscle pains. You'll likely have more energy and a greater ability to join in desired activities. You'll have a better regulation of your body fluids and blood pressure. You'll reduce the burden on your heart and your circulatory system. And you'll sleep better. You also have reductions in blood triglycerides, blood glucose, and your risk of developing type 2 diabetes. You'll reduce your risk for heart disease, and you'll reduce your risk for certain cancers, including liver cancer, as well as colon, breast, and prostate cancer that I talked about previously. So this is all fine and good, but if you're anything like me and most of America, you've tried to maintain a healthy weight, or you've tried to lose weight in the past, and maybe you've had some small successes, but oftentimes you've experienced more failures than success. So I want to leave you with a couple of tips for weight loss success that have been medically proven. The first thing is to change the mindset. The overall goal here is really sustained change. And in order to make sustained change, it's just not feasible to try to set out to lose 100 pounds or I want to lose 50 pounds. That can be very difficult, and you need to try to break it into smaller goals. So what we usually tell our patients is to start anywhere between 5 to 10% of your total body weight and aim for that as an initial goal. The safe weight of weight loss is about 1 to 2 pounds per week. The second thing that I emphasize with my patients is that weight loss really needs to be individualized to you. There is absolutely no one lifestyle that's going to work for everybody. And you need to consider your other goals. Has your doctor told you you need to lower your blood sugar or your cholesterol or your blood pressure? What is the motivation for why you want to lose weight? And then you need to ask yourself, well, where have you been before? What have you tried that hasn't worked, or what have you tried that has worked? And then what motivates you? It's one thing for me as a physician to tell my patients that they need to lower their blood pressure, but if you don't care that your blood pressure is elevated, then that's not going to be motivating for you to want to lose weight. And then finally, to remember that weight loss is really about behavior modification. You have to make small changes into habits that you've likely developed over your entire lifespan, and so making one huge overhaul in a short period of time is probably not going to be successful. The third thing is that it's really important to find support, and we have multiple studies now that have shown that weight loss attempts are more successful and sustainable if you enlist the help of friends and family and your physician. So let people know what you're trying to do. Surround yourself with people who are like-minded and people who support your goals. And then finally, when you're making a weight loss goal, make it what we call a SMART goal and then share it with other people. And when we talk about SMART goals and we talk about goal setting, we talk about making a goal specific, measurable, attainable, relevant, and time-bound. So what does this mean? So instead of saying, I want to lose weight, for example, you could say, on April 1st, I will lose 5 pounds by counting calories, eating smaller, healthier portions, and by walking for 30 minutes 3 times a week. Do you see how that's different than just making the blanket statement, I want to lose weight? It's something that's specific, it's measurable, 5 pounds, I can measure that on a scale. It's attainable, it's safe at 1 to 2 pounds per week. It's relevant to me because I want to be healthier, and it's time-bound. I set a date for it. So the last part of this is I want to again talk about exercise, because you can't have a healthy lifestyle if you're not moving. And of course, I get this from patients all the time. I just don't have time to get to the gym or work out. And I come back with this, what fits your busy schedule better? Exercising 1 hour a day or being dead 24 hours a day? And it is funny, but it's also true. We make time for a lot of things in our life, but we often don't make time to make ourselves healthy. So in order to maintain a healthy weight, you really do have to move. And there's 2 types of physical activity that are recommended by the Center for Disease Control: aerobic activity as well as muscle strengthening activity. Well, how much activity is needed? Well, the CDC recommends at least 150 minutes per week, which is equal to about 30 minutes 5 days a week of moderate intensity activity, which basically equates to brisk walking. And strength training should occur on at least 2 days a week. So I know that 150 minutes a week sounds like a lot of time, but it's really not. It's about 2 hours and 30 minutes a week. It's about the same time that you probably spend watching a movie on a Saturday evening. So what are some specific tips for exercise success? The first one is to find an exercise that suits you. You need to find something that fits your personality. If you're a social person, do something that engages you socially. Take a group exercise class or join a kickball team or start a walking group with friends. Or if you prefer to have alone time, try walking or jogging might be a better fit for you. Finding a peer group is really the perfect way to connect with others who share your goals, lifestyle, schedules, and hobbies. The second thing is to make it a habit. It can take a little while for something to become a habit, so give yourself the time to create a regular routine. One way is to try to exercise around the same time each day. Exercise can really become addictive in a very positive way. Once it becomes a habit, you'll actually notice when you aren't doing it. The third thing is to build exercise into your lifestyle. Be honest with yourself. If you don't live close to a gym, it's probably going to become a hard habit for you. Likewise, if you're not a morning person, don't plan on somehow getting up at the crack of dawn to make a boot camp class. That's not going to happen. The key is really to build the activity into your lifestyle so that it's not disruptive. Examples could be you could borrow exercise videos from the library, or you could download an app on your phone. You could do some weight or resistance training with items you have around your house, like canned goods to use as light weights. And again, I emphasize walking because it's just such a great option and it's portable, and the only thing you need is a good pair of shoes. The fourth tip is to do bouts of exercise, and I say take 10, because studies have shown multiple times that it's okay to break up those 30 minutes a day into 10-minute intervals. So consider getting up in the morning, doing a quick calisthenics routine, then at lunch take a brief walk, and then if you commute with public transportation, consider getting off a stop earlier and walking the rest of the way home, and boom, you've done 30 minutes of physical activity that day. And the fifth thing is you got to keep going. I think we all get tempted when we fall off the wagon and the resolution that we've made to just stop altogether. But if you miss a day or a workout, don't worry about it. Everybody struggles once in a while. Just make sure you get back at it the next day. It doesn't take too long to get back on track once you've made something a habit. So give yourself grace, pick yourself up, and try again. So what's a practical first goal that you might want to take? Well, I offer you this 10,000 steps a day program, which most of you have probably heard about or seen in the media. But this is an initiative by the CDC to try to get Americans moving more. It's equal to about 5 miles a day, and it takes about 1 to 2 hours per day to achieve. And really, it centers around getting a pedometer and then tracking how many steps you take in a day. You can get fancy trackers, which sell at Best Buy for over $100, or you can go to Walgreens and pick up an inexpensive tracker for less than $10. It really doesn't matter. The goal is just to track how many steps you take. Once you've done that, the reasonable goal is to then increase your daily steps by 500 per week until you can hit that 10,000 steps per day goal. Don't go out and try to do 10,000 steps a day if you're only taking 3,000 steps at baseline. You're going to set yourself up for failure. Make small goals, and pretty soon, over a course of about 8 to 10 weeks, you'll hit that 10,000 step a day goal, and it won't even seem like you've made a huge change, and it can make big changes in your life. The second piece of exercise and moving is that to improve liver health, you have to reduce your sedentary time. Here's a sobering statistic for you. The typical American spends about 21 hours a day sedentary. And this is what happens when you sit. Your entire body slows down. You have inactive muscles, which leads to fewer calories burned. You slow your blood circulation, and so you get fatty acid buildup, and you actually get less oxygen to your brain, so you don't think as well. Your muscles begin to weaken, especially in your abdomen, your hips, and your glutes. And your organs may be impaired. There's been studies that have shown that your arteries get really stiff, your pancreas gets overstimulated, and it secretes a lot of insulin, and so you develop insulin resistance. And your bones get weak. You can develop scoliosis and degenerative disc disease in your spine. And it's been shown that increased sedentary time is associated with fatty liver disease, diabetes, heart disease, and early death. So what are a couple tips to reduce sedentary behavior at work? Get up to relay a message to a coworker rather than sending an email. And I'm guilty of this all the time. Just get up and walk down the hall and tell somebody what you need to tell them. Stand when you're talking on the phone or when you're doing a conference call. Take the longer route to the bathroom or the break room. Set a reminder each hour to stand in place, stretch, or take a quick walk around the office. Eat your lunch standing up. Or take a walk for a portion of your lunch or breaks. Find a group of friends at work with similar goals and say you're going to eat for the first 20 minutes of your break and then take a quick walk for the last 10 minutes. Park as far away from the building as you can and walk further into work. Pick up the pace when you're walking to meetings. And if you're like me and you're often late to your meetings, this is very effective. And then take the stairs rather than take the elevator. And also consider using a stability ball as a desk chair. And this has become very popular here at Northwestern. We have a lot of people who swapped out their desk chairs and now balance on a ball for more active sitting, which has been shown to burn more calories and strengthen those abdominal muscles. So what about reducing sedentary behavior at home? You could stand the entire time while you wait for your meal to finish cooking. You could take a walk after dinner with your spouse or your dog or your kids. Use commercial breaks as exercise breaks. If you're watching your favorite program, tell yourself that at each commercial break you're going to stand up and do some stretches. Sit on a stability ball again rather than on the couch. Or get up and stretch if you're reading a book after each chapter. If you play video games, try to stand while doing so. Consider performing light exercises while cooking dinner. Those pots and pans make good weights. So in summary, healthy living is about lifestyle change. There is no safe level of alcohol intake in chronic liver disease, and I do want to emphasize that. Obesity is the most common cause of liver disease in the United States, and our Western diet has many poor health effects beyond just weight gain. A healthy lifestyle really includes maintaining a healthy weight, and exercise has many health benefits even in the absence of weight loss. It's really important that you make SMART goals in order to achieve healthy living success. Make them specific, measurable, attainable, relevant, and time-bound, and share them with friends and family. I want to thank you very much for your time, and I look forward to any questions that you may have.
Thank you so much, Dr. VanWagner. At this time, if anyone has a question, could they please type it into the box and I'll read them out loud.
While we're waiting for questions to be typed in, I do want to encourage you, if you have specific questions that you don't want to type in your webinar, you can feel free to email me. My email address at Northwestern is right there. And then I do want to bring your attention to the key resources that I put at the bottom, the CDC website and the heart.org website that I shared with you during the presentation. And then that first website up top, the Super Tracker, which is from the USDA, from the government website, is really a neat website where you can type in your current activity level, and it will give you your recommended calories that you might need to burn in a certain day in order to achieve your weight loss goal. So it's sort of a neat app that they have. So it looks like we have a question. And the first question is, do you recommend any multivitamins or any specific supplements to patients with early liver disease? And that's a great question, and I'm sorry I didn't have time to kind of get into that arena. Currently, we don't recommend any liver-specific supplements, but there are a couple of key things in liver disease that are important to consider. Liver disease, especially bile duct diseases, you can have accelerated bone loss because of loss of vitamin D and calcium. And so I do recommend to most of my patients that they take at least a daily vitamin D calcium supplement because we know that patients who have liver disease can be losing those minerals in particular. I think a general multivitamin that's age appropriate, whether you're premenopausal or postmenopausal, is very important to take a multivitamin because, again, in our Western diet, we just don't get enough of the needed daily nutrients that we need. And so to most of my patients, I recommend that as well. And the last thing that I'll say as far as supplements or herbals that have been studied is that, interestingly, coffee, and you may have read about this on the ALF website, at up to 5 cups of caffeinated coffee a day have been shown to decrease progression of chronic liver disease as well as to prevent liver cancer, up to a 40% reduction. So if you don't have a contraindication to caffeinated beverages or drinking coffee, meaning you don't have problems with your heart, or you don't have problems with having reflux disease or heartburn or ulcers, and it's safe for you to drink coffee, that I would recommend unsweetened, non-dairy added black caffeinated coffee up to 5 cups a day to try to prevent your progression of liver disease. And that's been proven in many epidemiologic studies now. That's an excellent question. Are there any other questions from anyone?
If there are no other questions, we can end now, and you have the doctor's email right here, and everyone has an email from me where I sent out the webinar address, so please feel free to send any questions and I can send them over. And I want to thank everyone for joining us and give a big thanks to Dr. VanWagner for the great presentation.
Thank you, everyone. Have a wonderful day.